Hello, my name is Jessica Thomason, and I'm a licensing specialist in the Office of Child Care within the Early Learning Division of the Oregon Department of Education. On August 14, we issued new guidance for operating childcare and other early education programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. Please start by watching the introduction video from ELD Director Miriam Calderon. The introduction video describes the purposes of the guidance and the process we use to develop it. Then watch the overview video. The overview video describes who the guidance applies to and the process you need to follow to legally operate. For example, we continue to operate under the Emergency Child Care or ECC system, requiring licensed child care providers and others to apply and be approved to operate as an ECC. This video covers transportation. This is section 12 of the new guidance, and you'll find it on pages 56 and 57. The focus of this section is protecting against spread of the virus when a child care program is transporting children. Transporting in a bus, van, or car has the potential to put children and adults close to one another when we need to keep our distance from each other to reduce the spread of the virus. Some of this information overlaps with other sections like daily health check, cleaning and sanitation, record keeping, and personal protective equipment. We'll have videos on each of those, so be sure to watch all of them for details. Please note, this section of the guidance has many elements that don't apply to all programs. Not every child care uses a bus or transports kids in a vehicle at all. If something clearly does not apply to your program, just move on to the next point. Here's the overview of the section. If your program is transporting children, create a transportation plan and share it with your staff and the families you serve. Your plan must include the following: how you'll conduct health screenings for staff and children, facial coverings, and if required, clean outer layers of clothing on staff. For more information on who is required to wear a clean outer layer, refer to section 6 in the guidance that discusses health checks. Cleaning and sanitizing schedule and how you'll document that. A transportation schedule that minimizes the time a child is in transport. The ways you'll communicate with families and staff about additional health information and any updates. Procedures to send home sick children who use your transportation. If a child becomes sick while in care, send them home as soon as possible and don't transport them in the same vehicle used to transport other children in the program. Require that transportation is provided to only one stable group of children at a time. This group can be different from the stable groups within the facility. Require transportation staff to comply with the daily health check requirements in the guidance, and they are subject to the exclusion and quarantine rules, just like any other staff. Require an adult to bring children to the vehicle and remain until after the daily health check. Conduct a daily health check described in the daily health check section of this guidance before the child gets on the bus or in the van. The daily health check needs to be recorded. Transportation staff and children kindergarten and up must wear face coverings or face shields. Kindergarten children are defined as children who have turned 5 by September. This is the age when they become eligible to enroll in kindergarten. Assign children to the same seat every day. A seating chart must be developed and displayed for all transportation staff so they can help keep kids safe. To reduce person-to-person transmission, transportation staff need to make sure children are at least 3 feet apart during transport. This may mean that you have to transport fewer children than your vehicle has capacity for. If you are transporting with your personal vehicle and don't have space to distance children in this manner, you will need to plan ahead with parents and find ways for them to support transporting their children to and from childcare. Staff must use hand sanitizer in between helping each child and when getting on and off the vehicle. As always, hand sanitizer must be between 60 to 95% alcohol and must be kept out of children's reach. Load and unload children in a manner that reduces children from passing by each other. Immediately after each transportation session, clean and sanitize the vehicle. Pay special attention to frequently touched surfaces like seats and car seats, the steering wheel, door handles, handrails, seat belts, air vents, and the top of seats. Sanitation products must be approved by the EPA for use against the COVID virus. See the cleaning and sanitation section for more details, including the link to the EPA list of products. Transportation is not allowed for field trips except under very specific situations. Please refer to Section 7, Daily Activities, for more information about field trips. Beyond these requirements, we do have recommendations to enhance health and safety. Programs providing transportation may want to build classroom enrollment based on transportation needs to minimize crossover interactions between children. The adult dropping off children for transport should be a household member. Air circulation should be prioritized, weather permitting, and as long as it doesn't pose any other risk, windows should be kept open. You may already have questions. Please email them to providercontact@state.or.us. We have an FAQ section on our website, and we'll continually update that with your questions and our answers. Thanks for watching, and thank you for providing nurturing care and education to children and this crucial resource for Oregon's working families.